This study, in fact, is a very large randomized study, which actually getting more than 7,000 patients randomized in various arms. Two main arms, one of them receiving this medicine, dexametazone, the other one against the standard of care. So this is, in fact, is a breakthrough which shows 35% decrease in death among those who need the treatment with ventilation, ventilation machine they need, and 20% decrease among those patients who need oxygen supplements. So that's already a very, very good news for the management of the severe form of COVID-19. So in a sense, so far, this is the first ever medicine which can decrease the mortality among COVID-19, severe COVID-19 patients. Patients who are the severe form of COVID-19, as you know, 80% of the people who get COVID-19 have mild symptoms, but those less than 20% who have developing severe form of the disease at this stage, which basically need to be hospitalized, they need to be on ventilation, or they need oxygen therapy. And these patients can benefit, based on this data, can benefit from these medicines. Obviously, there is a need for more meta-analysis, meaning that we need to look at this data as well as any other data globally, what WHO is going to do before recommending fully this treatment. But so far, these results has been very, very promising for severe cases of COVID-19. Dexametazone is similar to other glucocorticoid medicines. Basically, we have in our body also naturally cortisones, which is against the infection or stress. So this is kind of the family of the glucocorticoids, which is actually one of the strongest one, but very strong, and has anti-inflammatory and immunosuppressive role. Obviously, as you know, when the COVID-19 patients develop severe form, and which in fact their own immune system is activated against the different cells of the body. So it's very important to have the immunoregulation. So that's the way it works, both increasing the inflammation, which also decrease the other severity of the disease, but also in terms of the reaction of the body to the disease will be less severe. Dexametazone has been fairly commonly used for other diseases like arthritis or allergies or asthma, or even some forms of cancers. Basically, to have a kind of the natural effect of that they have in anybody. So this basically also used in other diseases. Obviously, it's the first time that we can see it as an impact as it has on the COVID-19. Like in any other kind of medicines, there are adverse events. Some of them are mild, like dizziness or mood change or vision being blurred or headaches. But some of them can be even more severe, particularly the blood sugar can have impact on that one, or on heart. So people who have heart disease or hypertension or stomach problem or even osteoporosis, they have to take extra precautions. So extremely important for the physicians to take into account all clinical condition of their patients before prescribing dexametazone or any similar medicine. In terms of immunosuppression, yes, they may have some concern. We have to yet to learn about the effect of it. But obviously, when the COVID-19 is at that severe stage, we need to see how we can save the patient's life. But we need to also take into account if other patient had other conditions, could it be an HIV, could it be other areas, what would be the impact of the dexametazone. It can be dangerous for old people, particularly those who have hypertension or diabetes. So it's extremely important that the physicians look at the clinical condition of the patients. But also we know that COVID-19 has the highest mortality among the elderly people. So that should be basically a careful balance between the added value that this medicine is going to bring vis-a-vis other adverse events that patients may have. I think we should be very clear. This is not a silver bullet. So far we do not have any antiviral like anti-HIV or so we need to basically look further for medicines which can have a major impact on inhibiting or killing the virus. That we don't have yet. But on the other hand, is already a lot of good progress. So what is important to make sure a good balance is there. So at WHO, we are looking at all this data. We are making a meta-analysis, meaning that we look at all other publications as well that are coming. And obviously this will be taken into account if the new clinical guidelines of WHO will recommend these medicines and how and which dose. But that is going to be all discussed further in the coming days.